Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the beta cells of the pancreas, causing the body to produce very little or no insulin. Type 2 diabetes is a condition in which the body does not use insulin effectively, while the pancreas may also fail to produce enough insulin to keep blood sugar levels within the normal range. Both conditions cause high blood sugar, but one is primarily caused by a loss of insulin production, while the other begins with insulin resistance. So, how are these two diseases actually different? In type 1 diabetes, the body has a severe lack of insulin, so people with the condition need to use insulin every day to stay alive. In type 2 diabetes, the body can still produce insulin, but the cells respond poorly to it, and insulin production may gradually decline over time. Type 1 diabetes is primarily caused by an autoimmune reaction, in which the immune system mistakenly identifies the beta cells of the pancreas as a threat and destroys them. Type 2 diabetes is commonly associated with insulin resistance, along with genetic factors, overweight or obesity, and physical inactivity. One involves the immune system attacking the body itself, while the other involves the body gradually losing its ability to use insulin effectively. So, what factors actually lie behind these two diseases? In type 1 diabetes, certain genes may create a predisposition to the disease, while environmental factors may help trigger the autoimmune response. However, the exact cause is still not fully understood. In type 2 diabetes, the risk increases with overweight or obesity, physical inactivity, a family history of the disease, and other factors that affect the body's ability to use insulin. In type 1 diabetes, the pancreas produces very little or almost no insulin, preventing glucose from entering cells efficiently to provide energy. In type 2 diabetes, the body still produces insulin, but the cells do not use it effectively, while the amount of insulin produced may also become insufficient to control blood sugar. One condition involves an almost complete loss of insulin, while the other still has insulin but the body cannot use it effectively. So, what role does insulin play in these two diseases? In type 1 diabetes, insulin is essential for survival because people with the condition need daily insulin replacement to control their blood sugar. In type 2 diabetes, some people can control their blood sugar through lifestyle changes and medication, while others may eventually need insulin when the body no longer produces enough insulin or other treatments are no longer sufficient to control blood sugar. Type 1 diabetes can develop at any age, but it is most commonly diagnosed in children, adolescents, and young adults. Type 2 diabetes most often develops in adults and older people, but it is increasingly being diagnosed in children and adolescents as well. One often appears earlier in life, while the other is more common in adulthood. But is age enough to distinguish type 1 from type 2 diabetes? Type 1 diabetes can develop in both young children and adults, so age alone cannot be used to determine which type of diabetes a person has. Type 2 diabetes is more common in adults, but age is no longer an absolute indicator, since the condition can also occur in younger people. Type 1 diabetes is associated with genetic factors and a family history of autoimmune diseases, while environmental factors may also contribute to triggering the disease. Type 2 diabetes has several well-established risk factors, including overweight or obesity, physical inactivity, family history, and increasing age. One is more difficult to predict because it involves an autoimmune response, while the other has several identifiable and potentially modifiable risk factors. So, who is at greater risk of developing these two types of diabetes? For type 1 diabetes, the risk increases with certain genetic factors and a history of some autoimmune diseases, but there is currently no reliable way to predict exactly who will develop the condition. For type 2 diabetes, the risk increases significantly with overweight or obesity, physical inactivity, a family history of diabetes, and a history of prediabetes or gestational diabetes. Type 1 diabetes often causes symptoms such as excessive thirst, frequent urination, increased hunger, fatigue, blurred vision, and unexplained weight loss. Type 2 diabetes can also cause excessive thirst, frequent urination, fatigue, and blurred vision, but many people may have few or no obvious symptoms for a long time. One type often reveals itself quickly, while the other can develop silently over many years. So, how can we recognize the differences between type 1 and type 2 diabetes? In type 1 diabetes, symptoms often appear rapidly, sometimes within days or weeks, and some people are diagnosed only after developing diabetic ketoacidosis, a serious complication of uncontrolled diabetes. In type 2 diabetes, symptoms usually develop more slowly and may be mild enough to go unnoticed, with some people discovering the condition only after diabetes-related complications have already developed. Type 1 diabetes can develop rapidly, with symptoms often appearing within days or weeks, as the body becomes severely deficient in insulin. Type 2 diabetes usually develops more gradually. Symptoms can progress over many years, and many people may not even realize they have the condition. One can make a person aware of a problem within days or weeks, while the other can remain hidden for years. So, why does the progression of type 1 and type 2 diabetes differ so dramatically? In type 1 diabetes, the autoimmune process rapidly reduces the body's ability to produce insulin. Once insulin levels become critically low, blood sugar can rise quickly and symptoms can become obvious. In type 2 diabetes, insulin resistance usually develops gradually, while the pancreas can initially produce more insulin to compensate. As a result, blood sugar may rise slowly before symptoms become noticeable. Type 1 diabetes is diagnosed through blood glucose tests, but to determine whether it is type 1, doctors may also test for autoantibodies associated with the autoimmune response. Type 2 diabetes is also diagnosed through blood glucose tests, such as fasting blood glucose, HbA1c, or an oral glucose tolerance test. Doctors then use the person's medical history and other necessary tests to determine the type of diabetes. Both types can be detected through blood glucose testing, but blood glucose levels alone cannot determine whether someone has type 1 or type 2 diabetes. So, how do doctors distinguish between the two? For type 1 diabetes, doctors may test for specific autoantibodies and assess the body's ability to produce insulin to look for evidence of an autoimmune process. For type 2 diabetes, doctors generally consider blood glucose results together with medical history and risk factors. Additional tests may be performed when necessary to rule out type 1 diabetes or other forms of diabetes. Type 1 diabetes requires insulin treatment because the body no longer produces enough insulin to sustain normal function and life. Type 2 diabetes may be managed through lifestyle changes and medication, while some people may also need insulin. One requires daily insulin, while the other may initially be managed through lifestyle changes and medication. So, how do the treatment approaches for these two types of diabetes differ? For type 1 diabetes, people generally need insulin delivered through injection pens, syringes, or an insulin pump, along with regular blood glucose monitoring. For type 2 diabetes, treatment often combines a healthy diet, physical activity, weight management, and blood glucose lowering medication. Some people may eventually need insulin when other treatments are no longer sufficient to control blood sugar. People with type 1 diabetes need to pay close attention to the amount of carbohydrates in each meal, so they can coordinate their insulin dose and manage their blood sugar. People with type 2 diabetes also need to manage carbohydrate intake, while paying particular attention to portion sizes, food quality, and weight if they are overweight. Both require a balanced diet, but type 1 diabetes requires especially careful coordination between food and insulin, while type 2 diabetes often places greater emphasis on weight management and insulin resistance. With type 1 diabetes, people can learn carbohydrate counting to adjust their insulin doses according to the amount of food they eat and their daily activity levels. With type 2 diabetes, a diet rich in vegetables, high-fiber foods, and appropriate sources of protein, while limiting added sugars, can support blood sugar and weight management. With type 1 diabetes, physical activity remains very important, but it needs to be carefully coordinated with insulin and carbohydrate intake to reduce the risk of blood sugar dropping too low. With type 2 diabetes, physical activity helps the body use insulin more effectively and supports blood sugar control, weight management, and cardiovascular health. Both types of diabetes benefit from physical activity, but type 1 diabetes requires more careful management of blood sugar and insulin during exercise. So, how should people with these two types of diabetes stay active? People with type 1 diabetes need to monitor their blood sugar and plan appropriately around insulin, food, and exercise timing, because physical activity can lower blood sugar during exercise and for several hours afterward. People with type 2 diabetes are generally encouraged to increase regular physical activity, with a common goal of around 150 minutes of moderate intensity exercise per week, combined with muscle strengthening activities. Type 1 diabetes can damage the heart, kidneys, nerves, eyes, feet, and teeth if blood sugar remains poorly controlled over a long period of time. Type 2 diabetes can also lead to heart disease, stroke, kidney disease, nerve damage, eye problems, and foot complications, and it may also be associated with fatty liver disease and other health problems. Both types can silently damage multiple organs, especially when blood sugar remains high for a long time. So, how do the complications of type 1 and type 2 diabetes differ? With type 1 diabetes, in addition to many of the same long-term complications seen in type 2 diabetes, people face a particular risk of diabetic ketoacidosis, a serious acute condition that occurs when the body has a severe lack of insulin. With type 2 diabetes, the disease can progress silently for years before it is diagnosed, meaning complications such as heart disease, kidney disease, eye damage, and nerve damage may already be present when the condition is discovered. There is currently no proven way to prevent type 1 diabetes, because the disease involves an autoimmune reaction that destroys the insulin-producing cells of the pancreas. Type 2 diabetes can be prevented or delayed in many people by maintaining a healthy weight, eating a healthy diet, and increasing physical activity. One cannot currently be prevented through conventional lifestyle measures, while the other can have its risk significantly reduced through lifestyle changes. So, what can we do to protect the body from these two diseases? For type 1 diabetes, scientists are still studying ways to slow or prevent the autoimmune process, but no lifestyle intervention has been proven to completely prevent the disease. For type 2 diabetes, losing weight when overweight, maintaining regular physical activity, and following a healthy eating pattern can help prevent or delay the disease. The Diabetes Prevention Program showed that lifestyle changes can substantially reduce the risk of developing type 2 diabetes in people at high risk. Type 1 diabetes is increasingly supported by technologies such as blood glucose meters, continuous glucose monitoring systems, and insulin pumps. Type 2 diabetes can also be managed with blood glucose meters, continuous glucose monitors, and digital applications that help people track and manage their blood sugar. Both types benefit from technology, but type 1 diabetes has seen the development of systems that can automate blood glucose monitoring and insulin delivery. So, how has technology changed the lives of people with diabetes? With type 1 diabetes, automated insulin delivery systems can combine a continuous glucose monitor, an insulin pump, and an algorithm to automatically adjust insulin delivery based on blood glucose levels. With type 2 diabetes, technology mainly helps people monitor blood sugar, physical activity, diet, and medication. Some people who use insulin may also use continuous glucose monitors or insulin pumps when appropriate. Living with type 1 diabetes requires people to monitor their blood sugar, use insulin, and adjust their food intake and physical activity as part of their daily routine. Living with type 2 diabetes generally focuses on managing blood sugar, diet, physical activity, weight, and prescribed medications. Both require daily disease management, but type 1 diabetes is generally associated with lifelong insulin therapy, while type 2 diabetes can be managed through several different approaches. So, which condition creates greater changes in everyday life? With type 1 diabetes, people need to actively calculate insulin, food intake, and physical activity while monitoring blood sugar regularly to reduce the risk of levels becoming too high or too low. With type 2 diabetes, people generally need to build a sustainable long-term lifestyle that includes an appropriate diet, regular physical activity, proper use of medication, and routine health checkups. Type 1 diabetes accounts for approximately 5% to 10% of all diabetes cases, making it significantly less common than type 2 diabetes. Type 2 diabetes accounts for approximately 90% to 95% of diabetes cases and is by far the most common form of the disease. One accounts for only a small proportion of diabetes cases, while the other makes up the vast majority. So, why is type 2 diabetes so much more common than type 1? Type 1 diabetes is primarily associated with an autoimmune reaction that destroys insulin-producing cells, so it is not the most common form of diabetes. Type 2 diabetes is associated with insulin resistance and multiple risk factors, including overweight, obesity, physical inactivity, and family history, making it the most common form of diabetes. The future of type 1 diabetes is moving toward earlier detection, slowing the autoimmune process, and developing technologies that make insulin management increasingly automated. In 2026, teplizumab has also gained expanded FDA indications, including delaying the onset of stage 3 type 1 diabetes in eligible people with stage 2 disease, and delaying the decline in insulin production in certain children and adolescents recently diagnosed with stage 3 type 1 diabetes. The future of type 2 diabetes focuses on prevention, weight management, new medications, and approaches that can improve blood sugar control, with the goal of reducing complications and extending healthy life expectancy. One side is looking for ways to intervene before the disease fully develops, while the other is moving toward better control and, in some people, even remission. So, how far could the future change the fight against diabetes? For type 1 diabetes, scientists are studying immune-modulating therapies, cell-based treatments, and technologies such as artificial pancreas systems to reduce the daily burden of insulin management. For type 2 diabetes, the focus is on early detection, preventing disease progression, and developing more effective treatments, while lifestyle changes remain an important part of prevention and disease management.